Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about cholera. Often when public health officials think of cholera, they remember its connection to the development of their field. You see, in the mid-1850s, people in London were falling ill. And although people were familiar with the disease, they didn't know what its cause was. There were two competing theories at the time. Some thought the disease was spreading through the air. This was called miasma theory. Others, including a doctor named John Snow, thought it was caused by something in the water. This was called germ theory. As more of Dr. Snow's patients fell ill, he got to work studying who was becoming ill and where they lived. He found that most of the people who died were getting their water from a specific water pump located on Broad Street. He also realized that very few inmates from a nearby workhouse were dying, and likewise workers from a nearby brewery were not experiencing similar death rates either. Now, both of these groups, while located near the Broad Street water pump, did not use water from the pump. So to test his theory, Dr. Snow persuaded local authorities to remove the handle from the Broad Street water pump to see if the disease rates changed. And what he found was that, indeed, the outbreak quickly wound down. This proved that the disease was being caused by something in the water, not in the air. And this finding contributed to our understanding of germ theory, which ultimately prevailed as we learned that infections are caused by specific pathogens. Because of his findings, Dr. Snow is often considered the father of epidemiology. And if you visit London today, you'll find a commemorative pump in the part of the city where the offending pump was located in the 1850s. During the next little bit, we're going to talk about cholera, its prevention, questions we've received here at the Vaccine Education Center, and the relative risks and benefits of this disease, and considerations related to vaccination. So let's get to it. Cholera is caused by a kind of bacteria called Vibrio cholerae. These bacteria attack the small intestine. Now, most people who are infected don't have any symptoms. Some will have mild diarrhea. But for a few people, usually about 5 out of every 100, they'll experience more severe disease that results in vomiting and diarrhea, and that can lead to dehydration. The dehydration can be severe and cause mineral imbalances, kidney failure, and even arterial blockages. The diarrhea and loss of fluids can be so severe that a person can go into shock and die. If a woman is pregnant, she can experience premature delivery or miscarriage. Now, in many places, people can be effectively treated with rehydration therapy, which involves the introduction of fluids and electrolytes that can restore the mineral balance and hydration. This type of therapy can either be given orally or, in some cases, especially in severe cases, intravenously, what we more commonly refer to as IV fluids. In places where rehydration therapy is not readily available, about 4 of every 10 people with severe disease will die from their illness. Cholera spreads in contaminated food and water. People can also be infected after eating shellfish that have not been properly cooked. Like with hepatitis A virus, which is also found in water, when these shellfish filter the water to search for food, pathogens like Vibrio bacteria and hepatitis A virus become concentrated in the shellfish, enabling that pathogen to be introduced when people eat it. Travelers can also avoid the risk for cholera if they take precautions like staying in areas with standard tourist accommodations, eating only properly cooked foods, especially but not limited to shellfish, practicing good hand hygiene, such as hand washing before eating and after using the bathroom, and drinking bottled or treated water. Now, determining the actual rates of cholera is a bit difficult for a few reasons. First, many people don't experience symptoms, or their symptoms are minor, so they don't seek medical care. This makes it difficult to know the true number of cases that occur during an outbreak. Second, the spread of cholera is in part due to sanitation levels, so we really see cholera in 2 distinct situations. In some cases, cholera is endemic, meaning that there are ongoing cases. And this happens in places where sanitation standards are low, such as in developing countries. The second situation we see is called an epidemic or an outbreak. And this happens in situations where the infrastructure has been damaged, causing a decrease in sanitation, such as because of a natural disaster or a war. Climate change also has had an effect on the rates of cholera, particularly because of changes in water cycles from things like increased rainfall and flooding in some areas. It's estimated that about 4 million cases of cholera occur around the world each year, with about 143,000 deaths. In 2024, about 98% of cases occurred in Africa, the Middle East, and Asia. In the United States, rates are low and usually result from either travel to areas with the disease or from eating undercooked shellfish, such as crabs. So let's talk about the vaccine. A number of cholera vaccines have been made, but vaccination is not routinely recommended. Vaccines are safe, but two factors have contributed to their limited use. First, the risk of disease to travelers is usually low. And second, the immune response to the vaccine is short-lived. In the United States, one cholera vaccine is approved for use. It's known as Vaxchora. It can be used in people between 2 and 64 years of age, and it's given by mouth in a single dose. The vaccine is a live weakened version, and it can cause mild side effects like nausea, vomiting, or diarrhea. When we consider the global situation, 5 vaccines have been approved in different areas around the world, but supplies have been limited compared to the number of people who are at risk for this disease. Luckily, over time, supplies have started to improve. In the United States, cholera vaccine is generally not recommended prior to travel unless somebody's going to an area of the world where the disease is actively spreading. If the vaccine is recommended, it should be given at least 10 days before traveling, and people should not eat or drink for an hour before or an hour after getting it. So let's turn our attention to common questions. We don't really get many questions about cholera, particularly because the vaccine is not routinely used for most travelers. However, we have had some people wonder why hepatitis A vaccine is more routinely recommended compared with cholera vaccine, since both can be transmitted in contaminated water and shellfish. The answer to this question has more to do with hepatitis A virus, which is more difficult to remove from contaminated water. As such, it's more commonly found even in places with standard tourist accommodations. So let's finish up with a quick assessment of cholera disease and risk. As mentioned, cholera can be severe, but for most people it's mild, and it may even go unnoticed due to lack of symptoms. Even when travelers go to areas where they might be at risk, they can often protect themselves with common measures such as avoiding consumption of raw or undercooked foods and drinking bottled or treated water. In some cases, individuals will be recommended for vaccination, but most often that's due to the cases of cholera that are occurring where they're going and their travel-related risks based on their ability to practice some of the protective measures we already discussed. For these reasons, even though the vaccine is safe and only requires a single dose given orally, it's generally not recommended for most people. Thanks for listening today.